Hi there, Grant Blashki from familydoctor.expert. Today we're going to talk about the BRCA gene, which is associated with breast cancer. So unfortunately, in the community, breast cancer is really common. It's about 12% lifetime risk for most women. If you have this gene called the BRCA1 or the BRCA2 genes, your risk goes up during your lifetime of having breast cancer to between 30 and 60%. So you can see that's a really drastic increase. So we want to know if people have that gene. The BRCA gene is also associated with ovarian cancer. So if you have the gene, you have a 20% lifetime risk of ovarian cancer. Now generally, this sort of discussion is going to go on with a cancer specialist, a familial cancer specialist, or a geneticist, or a breast specialist. But just to give you a sense about this genetic testing, many patients come in and they say, well, should I go and get tested for this gene? Maybe I'm at risk. And the sorts of questions that your GP is going to ask you is, firstly, how many close relatives do you have who've had breast cancer, or even other sorts of cancers will be relevant as well. The second question the GP is going to ask is, how old were they when they had the cancer? We're more concerned if people have had cancers when they're young. If someone's had breast cancer under the age of 40 or an ovarian cancer under the age of 50, this is a bit of a red flag for us as well. We're also interested, did those relatives have multiple cancers? So if someone's had breast cancer in both breasts, or perhaps breast cancer and ovarian cancer, this is also raising a flag for us. Could that BRCA gene be in the family? There's some other things we think of. A risk factor would be having a male relative with a breast cancer, which can occur. And the other thing is some ethnic groups, so people of Ashkenazi Jewish background have an increased risk of having the BRCA gene too. So what if the gene test came back positive? What would that mean? Well, this would be something discussed with the specialist, but there's a few things to think of. First of all, there's a number of treatments ranging from hormone suppression treatments that try and reduce estrogen level to try and reduce the risk of cancers. But there's also the drastic measure of having prophylactic mastectomy. Another approach that's sometimes used is called bilateral Salpingo Oophorectomy. That's a bit of a mouthful. But basically it involves having the uterus and the ovaries removed. And this also reduces the risk of the breast cancer by reducing estrogen, and obviously reduces the possibility of ovarian cancer too. If you've got a strong family history of breast cancers in your family, particularly if it's on the same side of the family, particularly if it's in people who are a bit younger, this is something to raise with your GP. So I hope this is helpful. As usual, don't make any decisions just based on this video. It's for general guidance only. Discuss your specific situation with your GP. So I wish you all the best from familydoctor.expert.